Well, the other situation that we should look out for, especially in a victim who are having near drowning, is thing called hypothermia. Well, the word hypo means low, and thermia means temperature, while emia means the blood. So basically, low blood temperature. It is defined as hypothermia when the body core temperature falls below than 35 degrees Celsius. There are many causes to it. Um, some of the causes includes prolonged exposure to cold conditions, especially if you expose yourself to cold and very windy, even though in Malaysia. Now, in Malaysia is a very hot. We have basically sun. It's sunny all year round. But if it goes into the water, and when you come up of the water, and there's a lot of strong wind blowing, so your body temperature can goes down, or the victim body temperature can go down, and this can cause hypothermia. The other thing is inadequate clothing, and this leads to poor insulations. So again, this can lead to hypothermia. A short exposure to extremely low temperature also, let's say someone is basically fall into an icy water, and basically this also can lead to hypothermia, and victim can become hypothermic, especially in near drowning situations. Well, everybody can get hypothermia. However, there are some conditions that will cause increased risk, or what we call as risk factors for hypothermia. The first thing is age. The extreme of age, too young or too old, can easily get hypothermia, and this is due to poor regulation of heat, or the body heat, basically. The other thing is someone who have impaired mental status, example having a problem of Alzheimer. And why Alzheimer? Because they cannot remember, so they goes on wandering and basically expose themselves to extreme temperatures. Substance abuse, especially someone who are alcohols or drugs, and because of this, uh, some of the drugs cause vasodilatation, or the blood vessels basically expanded. When the blood vessel expanded, it goes nearer to the skin, and this could cause loss of body heat through the blood vessel that comes close to the surface. The other thing is actually someone having some medical condition like hypothyroidism. The thyroid organ is not really functioning very well. Okay, hypothyroidism, or someone with spinal cord injuries because the control of body temperature is lost. Strokes also because of the same reason, or someone having overwhelming sepsis. All of this can lead to the condition of hypothermia. Uh, these are basically how we divide hypothermia into mild, moderate, and severe, and the other thing is very severe. Now, our normal body temperatures basically goes around 37 plus minus 2 degrees. Now, even up to 36, we still accept it to be fairly okay. Now, but if the temperature falls 35 and below, this is where what we see that the person have hypothermia. So when the temperature basically goes down between 35 to 32 degrees Celsius, it is called mild hypothermia, and some of the symptoms are shivering, he look tired, lethargy, apathy, confused, and we have a rapid heart rate. The heart rate goes faster. Now, in moderate hypothermia is when the body temperatures goes less than 32, so it ranges from 28 to 32 degrees Celsius. All right, this is moderate hypothermia, which is basically characterized by the shivering has stopped at that time. You will not have people shivering. However, there will be more confusion, or even goes into delirium. He goes having some hallucination into this thing, thinking of something which is not there. The heart rate starts to go slow. See, from the very rapid heart rate in mild hypothermia to a slowing of the heart rate in moderate hypothermia, and sometimes the heart rate can become irregular. However, if the body temperature carry on to fall below 28 degrees Celsius, this is called hypothermia. And usually the victim of severe hypothermia will basically, the brain stops functioning, he goes into coma. Alright, he becomes unconscious and coma. The heart goes into a condition called ventricular fibrillation, meaning that the heart is not beating anymore. The heart is just quivering, and the guy may appears to be dead. Alright, and if the temperature falls about 20 and below, that is when the brain activity stops. So basically, 28 below is bad. It's very, very bad in severe hypothermia. All right. So we don't want them to go into very low, even though there are now some of certain situations where people use hypothermia, bringing down the body temperature, to start treatment, but that is in a very controlled situation. Okay. Now, so what do we do now? If we found a near drowning victim, we bring him out of the water. The first thing we need to do is that we have to remove him from the environment that is very cold. All right, but this is basically bringing him out of the water. Don't get him there. Now we need to. Another thing that kept him cold is because he's wet clothing. So we have to remove the wet clothing as soon as possible and give him warm, dry clothing, or with blankets. Okay, if possible. We need to monitor his breathing, or he or she breathing, and if it's become very slow or stopped, then we need to intervene, or maybe even CPR need to be initiated. So we need to see, because remember, the heart rate initially goes fast in mild hypothermia, but it starts to go slow in moderate hypothermia. Same goes with his breathing. It might slows down. So we have to monitor this thing. One thing about CPR, when you start to do CPR in a patient who is hypothermic, then it can be done longer, all right? Because low body temperature, somehow or other, it preserved the brain in terms of keeping it longer. So normally, if we say that the resuscitation time is about 20 or 30 minutes, now you should not start that timing until the body temperature has returned to normal. The other thing is actually we have to minimize rough handling or jerking movement to the patient, especially if the patient is lethargic or unconscious. This is I'm talking when he goes into like moderate hypothermia, because any rough movement or jerking movement of the patient can cause or lead to ventricular fibrillation, which is, remember, ventricular fibrillation is when the heart doesn't beat properly, it's not contracting, it's just quivering. Okay. Now we need to rewarm. Now sometimes just simple passive technique of just holding, rubbing the victim is good enough, but sometimes we need even to do more than that. Okay. What we can do, we can start with applying warm compress, not hot but warm compress, especially to the neck, to the groin, or to the armpit, where there is pulses, because when there's pulse, meaning that the blood vessel comes very close to the skin, so we want the heat goes back into the blood. Warm blankets is also one of the technique. Sometimes what you can do is a body to body contact in case where you don't have any other warm blankets or anything. So use your body temperature to warm the victim's body. All right. And further treatment depends on the severity of hypothermia. You might need to do what we call as active rewarming, but don't do it at the site. This is when you need to bring him to the hospital as soon as possible. In terms of rewarming, we can basically divide it into passive rewarming and active rewarming. Passive rewarming includes warm clothing, warm environment, as I have mentioned before, and this is especially for person who is conscious and who is shivering mild hypothermia. Active rewarming, this is patient with moderate hypothermia where there is signs of confusion, or there's some other medical condition that we need to tend to. And active rewarming includes giving warm fluids, warming blankets, and even warm humidified air. There is another thing called aggressive core rewarming, and basically this is more aggressive, where basically we instill water into the person's body, example fluids into the stomach and bladder, irrigation, warm solution into the chest or abdominal cavity. Now all of this is being done in the hospitals, not at the site. Right, or even sometimes we even have to put on the patient on the bypass machine. So with that, basically, for hypothermia, important thing is that when we rescue a victim having near drowning, they could be having hypothermia. We have to recognize what are the signs of mild hypothermia, moderate hypothermia, and especially severe hypothermia, and we need to basically do the rewarming process right from the site. Okay, thank you.